just my disclosures, I have received honorariums from Sandoz, AstraZeneca, and Bayer, but I was not paid to speak here today, and I try to keep my information as neutral as possible and just based on evidence, okay? Okay. There we go. So hopefully today we'll understand how prostate cancer and its treatments can affect bone health. We'll recognize the risks of bone loss, fractures, and osteoporosis in prostate cancer patients, identify lifestyle changes and medical interventions that help maintain strong bones, explore the role of medications in bone density changes, and engage in proactive bone health strategies. So my little skeleton there. So how prostate cancer treatment affects bone? So it's primarily through androgen deprivation therapy. Obviously, we're reducing your testosterone levels, which leads to decreased bone mineral density, and that's because testosterone plays a role in bone turnover. So our skeleton they're not just the frame for our body, it's also our calcium bank. So when our body needs more calcium, the bone cells will turn over using osteoclasts to release calcium into our bloodstream so that we can maintain adequate calcium levels. And our hormones play a role in that feedback loop in how much our skeleton turns over and how much calcium it releases. What we have found is that in androgen deprivation therapy, particularly in the first year, we see accelerated bone loss, and up to 85% of men may develop osteoporosis after 10 years on ADT. For some, it'll be faster, and for some, it'll be slower. And we always talk about the bone bank, right? So if we've made lots of deposits in our bone bank through eating lots of calcium, doing lots of resistance exercise, genetics often play a role as well. Then if we're taking withdrawals from our bone bank, if we have a big savings, then we're okay. But if our savings are not as good because we haven't made as many deposits for a variety of reasons, then we're going to be at risk for developing osteoporosis. Additional treatments, particularly in the adjuvant setting that we're using now and in the metastatic setting like abiraterone and enzalutamide, they further exacerbate that androgen pathway and can increase fracture risk and bone loss. And of course, with abiraterone, which is one of the medications that we use, we also give prednisone or dexamethasone with it. And we know that steroid use also significantly impacts our bone health as well. Okay. So how do we know if your bones are healthy or not? And there's a variety of tools. Number one, and I'll show pictures of those in just a second, we use tools like the FRAX or CAROC score to estimate your 10-year fracture risk. And these scores are actually quite accurate. And when it comes to BC, if you want a bone density test to be covered, you have to have a high fracture risk score based on the FRAX score. It incorporates factors that affect your risk for developing osteoporosis, so age, your body mass index, whether you smoke, how much alcohol you consume, if you've had prior fractures. Those are all taken into account and provide us with a 10-year fracture risk score. And that gives us an idea of how likely you are to have a fracture within the next 10 years. And then that triggers us to evaluate your bone density using a DEXA scan. So I think a lot of people will refer to it as a bone scan. And I just want to be clear that there are two different kinds of bone scans. There's the bone density test or DEXA scan, and then there's a nuclear bone scan. And the nuclear bone scan is what the oncologists will use to determine if there are bony metastases in the bone. So it's like a nuclear medicine test that looks at if there's activity in the cancer cells, right? So two different tests. So you might get a bone scan and it might be a bone density test, or it might be looking at your cancer, but they don't look at the same things. So having a bone scan for the nuclear medicine won't tell us your bone density, and the bone density test won't really tell us if you have cancer in your bones, okay? So with the bone density test, they look at what they call a T-score, which is essentially comparing your bone density score to the normal range between different ages. And we give you a diagnosis of low bone density or osteopenia if your score is between -1 and -2.5. Doesn't necessarily mean you need to start medication. It just tells us that your bone is not as strong as we would like it to be. And the actual diagnosis of osteoporosis occurs when your T-score is greater than or equal to -2.5. And that gives us a stronger indication that you should probably start on medication to help improve your bone density and reduce your risk of fracture, okay? So I hopefully not really great graphic, kind of stole it and put it on there from the Canadian Urological Association. But essentially, for patients, we look at risk factors, and the risk factors would be age greater than 65, a T-score of less than -1.5, current or history of smoking, a BMI less than 24. So if you're fairly underweight, which is, one of the rare things that we don't want your BMI to be low. If you have a family history of hip fracture, if you yourself have a history of a fragility fracture above age 50, or if you've been on an oral steroid for more than 6 months, those are all risk factors. So if you are on endocrine treatment and you have two of those risk factors, then you definitely should be getting a bone density test, which will help us understand your baseline and what your risk is, okay? And just a note about the fragility fracture. A fragility fracture means you experienced a fracture from an injury that normally shouldn't cause a fracture. So usually a fall from ground level shouldn't cause a fracture unless you were pushed or you were running or maybe you were walking quickly and trip, right? Like if you're just walking and you lose your balance and fall and you experience a fracture, there's a high suspicion that that was probably related to your bones not being strong enough. And so that would be definitely an indication that we need to do something about your bone health or at least take a look at it, okay? Okay. So this is the FRAX score questionnaire, and you can actually even look it up. It's just on the internet. And this is what I do for my patients. I put in their age, their sex, their weight, their height. I ask them all these questions. And then at the end of it, it spits out a score and says, your risk for a major osteoporotic fracture within the next 10 years is 10%, 20%, and a few other, femoral fractures and things like that. And then that helps me to fill out the form on the bone density test that says, yes, please pay for this test for me so that we can have it done, okay? So what can we do to manage our bone health? A lot of things, right? So regardless of whether you are on hormone therapy or not, I think that this is important for all of us to understand, men and women, which is that engaging in exercise is the best thing that we can do for our bones. The more that we challenge our bones and challenge our muscles, the more your body is like, oh, wow, I better build up a strong skeleton because, my body is doing a lot of things. And as we age, we lose muscle mass. So exercise not only helps us to have strong bones, but it helps us to have strong muscles. And if we have strong muscles, we're less likely to fall, right? So exercise is very, very important. In terms of calcium intake, I think this is a big question that people have. Like, do I take a calcium supplement? How much calcium should I take? And essentially, we should be getting around 1,200 milligrams of calcium per day. You can get it from either dietary sources or supplementary sources or a combination of the two. And usually dietary sources are preferred, and that's because there is some concern about side effects from taking high doses of calcium, that it may increase heart risk, okay? And this is for another day, but we know that hormone therapy for prostate cancer also increases your risk for cardiac events, right? So we kind of want to minimize that as much as possible. Vitamin D is also incredibly important, and vitamin D essentially helps your body grab that calcium and put it back into the bones. So I usually recommend, it says 800 to 2,000 IUs daily. I usually just recommend my patients to take 1 to 2,000. We live in the Pacific Northwest. We don't get a lot of sunshine. So it's important to take that vitamin D supplementation on a daily basis. Smoking cessation, of course, you're not going to talk to an oncology provider who doesn't say, please stop smoking. Lots of health benefits, but certainly for your bone health. And we also know that our patients who are undergoing cancer treatment, if they stop smoking, their outcomes tend to be better as well, right? Minimizing alcohol intake on the FRAC score. If you take more than 3 units per day, or no, 3 units per week, I believe. Let's go back. 3 units per day, which is pretty generous, considering that the Canadian guidelines are like, don't even drink one, right? So 3 units per day, please keep it below that. Maintaining a healthy body weight, so certainly not underweight, and I would say not overweight as well, just because that's a stress on your joints. And then reducing your risk for falls. So how do we reduce our risk for falls? We keep our bodies strong. We don't wear slippers around the house that don't have a back to them, right? We want to actually wear like full shoes. Take a look around your house. Do you have a lot of tchotchkes and end tables that you've got to navigate around? Do you have a lot of throw rugs that can be tripping hazards? Those sorts of things. If you're feeling like your body is getting weaker, do you have assisted devices to help you get up and down from chairs? Those are really important things to prevent falls. Not easy to kind of put into our homes, when we're wanting to stay independent and not have reminders that maybe we're not feeling as well as we would like to, but important to reduce risk for falls. And then where we come in as providers is we provide the pharmacological interventions. So perhaps we start you on medications like Boniva or Fosamax. We see those commercials all the time, or bone-targeted therapies like infusions like zoledronic acid or denosumab. Those are all options as well. And then for monitoring, if you have a bone density test done and your bone density is normal, then we really don't recommend another bone density test for 3 years. Even if you do start on medication, we want to give you 3 years because it takes time for your bone density to improve as these medications work. And we know that these medications work regardless of what your bone density looks like, as long as you're not continuing to lose. So those are a few things that we do to monitor. I'll talk a little bit more about side effects of medication in a little bit, but I think that as much as we can prevent, I think it's important because these medications can be strong. There's some side effects that are rare but serious. So if we can prevent you needing to take these medications, why not, right? So this is the Canadian Urologic Association guidelines. And if you just Google CUA bone health guidelines, it'll bring it up. So all men who are on androgen deprivation therapy should have a clinical risk assessment, so a FRAC score done. And then depending on that, a bone mineral density test may be recommended. And of course, taking that calcium vitamin D daily, right? And then the changes become if you have metastatic prostate cancer, then there's a stronger indication for taking bone-targeted therapies, particularly if you have bony metastases, because those metastases put you at risk for fracture. And so at BC Cancer, we refer all of our patients to our bone health specialists so that they can have a fulsome discussion with you about the risks and benefits and what they recommend. And they usually continue monitoring for those patients. And these guidelines kind of follow the European Society for Medical Oncology, the ESMO guidelines as well. This is an excellent source. I don't know if any of you have seen the osteoporosis.ca website. It's fantastic. They have a little tab under bone and muscle health, a calcium calculator. You can put in kind of an estimate of the foods that you eat on a regular basis in a single day, and it'll tell you if you're getting enough calcium or not. And so then you know if you need to take a supplement or not. So that's great. It also has a really good resource on exercise and what kind of exercise you should do to help with maintaining your bone health. So some special considerations, again, this is for patients with metastatic bone disease with cancer, and this is kind of a little pathway that helps us make decisions on who should get bone therapy or not. Yeah, so I put some guidelines in here. Hopefully you guys can see this again, or maybe the slides can be shared. But these are the CSEP guidelines are just your daily exercise guidelines. And then Inspire Health is a nonprofit organization that provides resources to patients who have been diagnosed with cancer. And some of the resources, they have some low cost exercise programs. They also, I believe, have like a one-time consultation with an exercise physiologist who can talk to you a little bit. And I would say that the rec centers are also helpful. Like if you needed to have an orientation to the gym just to see what kind of equipment you can use, that's also helpful. And then BC Cancer also has a page for providers on bone health, and we recommend the Sunnybrook, which is an East Coast organization, and they have some information on cancer treatment and risk for falls. So that is kind of like the quick and dirty of bone health. I did it in 25 minutes, which is pretty good. Lots of times for questions.